we believe that this is the best way that all our people in South Africa are going to access the best health coverage. But I think it is important to also make a point to say that we are cognizant of the fact that the current system has got a very asymmetrical way of which knowledge has been distributed, whereby it has always been more provider-centric as opposed to patient-centric. And I think what we would like to propose and would like to add to what the bill has already proposed is the fact that as we are now approaching NHI, as healthcare practitioners, we need to be in a position where we're going to focus mostly on educating patients and patients actually knowing about their illness in as much as we spend time in treating them. Because I think that is very important, Chairperson, because what that does, it automatically changes from the patient from becoming a passive recipient of healthcare to a more active recipient of healthcare. And that has been seen to have dramatic changes in terms of outcomes of the patient. A patient who understands their illness is a patient who gets better quickly. And this is one of the things that we want to inculcate. And these are some of the things that we agree with the bill. And in fact, the bill also talks quite significantly about the primary health care being the gatekeeper in terms of decreasing health costs in the country. We totally agree with that, and we would like the bill to be even stronger on that element as well. But also our primary healthcare facilities should be facilities that are going to be focusing in ensuring that the person themselves become the focus as opposed to the disease process in itself, but also ensuring that those facilities are looking after the whole community and be able to map up the geographic or the demographic illness of the community. So that is quite positive, and this is something that we support in the bill. But however, for us to be able to achieve this, Chairperson, it goes without saying that our infrastructure in the public sector requires a lot of upgrading. So in fact, there has to be a serious, dramatic infrastructure development in the government sector. So the first point of business for the bill, for the fund, has to be focused towards developing these facilities, such that if a person is going, in order for us to be able to achieve equity and an equitable healthcare delivery for everyone in the country, we have to upgrade those infrastructures such that if somebody is going to be receiving healthcare in an institution that has been deemed as a well-equipped primary healthcare facility, it should be similar to any other facility in the country. So that is quite important, and that can be a downfall for the fund if it's not addressed as early as possible. Now, in terms of the funding model in itself, I think our members, Chairperson, support any funding model that is going to ensure that there is going to be quality of healthcare for all South Africans, a funding model that is going to improve quality of life for all our members, but also a funding that is sustainable and is going to ensure that it continues to provide quality of healthcare without any glitches and provide equity and efficiency. And we're cognizant that the bill does not does not fully talk to how healthcare providers are going to be compensated, but also the way it is going to be funded also doesn't seem to be clear in the bill. However, our members are saying that we want to present ourselves to form part of the solution, whereby we can be able to participate in any pilot studies or any models that the bill would want to initiate, and be able to come up with a reasonable and a more sustainable way that the funding is going to be done. Now, one of the most contentious issues, Chairperson would agree, is the issue of medical aids and the fund and its coexistence. And I think Professor Chetty did indicate that in the beginning that we agree that there has to be pooling of funds from all sources, so that everybody can be able to receive these funds. But we're worried about a situation where medical aids are going to be dramatically be removed, and that aspect is no longer there. But I think Section 33 does talk to that issue to say that medical aids will only be removed once the fund has been running effectively, and we would want to ensure that that is what happens once the fund has been implemented. Now, on the last point, Chairperson, and this is one of the issues that our members has been raising ever since this bill has been published, is the issue of governance. And in order for us to be able to deal with the issue of corruption or undue influence into the fund. And one of the biggest issues is the constitution of the board. If you look at the bill, Chairperson, it talks about how the board is going to be appointed by the minister. And I believe the previous speakers did also talk to this issue. Now, we see this as an issue, Chairperson, because it means that there is likely to be undue influence on the board. Now, our suggestion is to say that perhaps what we can look at in this situation is that we can have the 11 members that are appointed by the minister through that process that was indicated in the bill. But we want a situation where stakeholders also form part of the board. So instead of perhaps having the 11 members of the board, we can now bring in an extra 10, which are going to be stakeholders who are going to be involved in decision makers. And I also understand that the stakeholders committee is also there in the bill, which is going to be there on an advisory basis. However, we feel that it is important that the stakeholders should also form part of the decision making in terms of making sure that there is transparency and there is no undue influence in the board as well. Now, one of the other areas that we would want to comment on, Chairperson, is the issue of the Office of Health Product Procurement. Now, the bill talks to this office being appointed by the board in consultation with the minister. It also does not appear to be very independent, this office, Chairperson, because it is appointed by the board, which is appointed by the minister, and it is at risk of undue influence as well. And as you have seen, with what has been going on in the country, there has been undue influence in such committees in government at the moment. What we want to suggest on this aspect is that we need to possibly look at having some sort of an oversight an independent oversight that overlooks this office, so that we ensure that the products that are being procured are products that are agreements that are above par and that for the benefit of the fund and the benefit of the entire population at large. Now, the last aspect that I also want to comment on, Chairperson, is the issue of the appeals tribunal. Now, the bill talks about an appeals tribunal or an appeals process whereby the CEO, if a complaint comes in, be it either a complaint of non-payment or a payment from a complaint from a patient regarding anything regarding the fund, the fund has to deal with this within the period of 30 days from under the CEO. And that should then be delivered to the results of that complaint should be delivered to the member, and the member now has 60 days to be able to complain to the appeals tribunal. Now, the structure that is proposed by the bill is that the tribunal needs to be appointed by the minister, and the board also is appointed by the minister. The board of the fund is appointed by the minister. The tribunal is appointed by the minister. So there's no clarity in terms of independence of somebody who's going to deal with this complaint moving forward. So we would want to suggest that perhaps the appeals tribunal should not necessarily fall under the fund, but rather be taken out of the fund, and it can be dealt with possibly by the Justice Department in itself. And I think the bill also does talk to that, to say that this appeals tribunal also has the same powers as the High Court. And I think it might be prudent for us to have this under the Justice Department. But also, just while we're still here, Chairperson, perhaps the duration of the appeals process as well appears to be quite lengthy. Now, the bill talks to the appeals process, the appeals tribunal only being able to give the results or the verdict of the appeals after 180 days, which is quite a lengthy period, Chairperson. I think you would agree with me that in the health sector, if somebody complains about possibly a payment of a specific treatment, and then the CEO gives that in 30 days, and then they appeal, then they've got another 180 days to get the verdict. that on its own can be quite detrimental in terms of somebody who receives, who needs care, care urgently. Perhaps the committee can really look at that and try and modify that to ensure that perhaps if there's a way that we can get these complaints to be much shorter in order for us to be able to deliver proper healthcare. But in closing, Chairperson, I think for us, we as an organization, we support the initiation of universal healthcare. And we're also cognizant of the fact that this is going to be a mountain to climb. However, as healthcare practitioners in private practice, we are availing ourselves to be part of the solution and ensuring that this bill goes through so that the greater South Africans manage to benefit from healthcare. Thank you. I'll hand over back to you, Chairperson.
Thank you very much. A men-only delegation. You will probably answer that in your organization you don't have women leadership. Maybe they'll be here next other time, or you don't think they are able to lead. You will help us to answer. Honorable members, I am just checking on my list and I haven't realized if there are any hours.
Let's come out of that to take you to the story. The family of Lee Matthews, who was murdered in July 2004 after she was kidnapped by self-confessed murderer Donovan Moodley, has called a media briefing. However, the Department of Correctional Services says there will be no parole hearing today.